the Honorable Senator Ben Cardin, Dean Michael J. Clag, colleagues and friends from the Public Health Advocacy community. On behalf of the Advocacy Working Group of the Bloomberg School of Public Health, welcome and good morning to you all. Mr. Senator, we are delighted that despite your heavy schedule, you were able to join us in this very important conversation. Thank you very much, sir, for coming. Today, we are dealing with a hot issue. Public health advocacy, that's the hot issue. That's why we're all here, and we expect more to come. And in fact, we have an overflow room reserved for more people coming in. Perhaps not as hot as the Ebola issue today, but certainly connected to it. And your presence here is a testimony to the ascendancy of this very topic. I would also like to acknowledge the presence here today of future generation leadership fellows from 14 countries around the world who are attending a leadership training program here in Maryland. Could you please stand up? Thank you very much for taking the time to join us. Please be informed that this opening session is also covered live via Hopkins webcast. So just assume you are on live TV. Throughout the day, you will have the opportunity to listen to our distinguished panel speakers and participate in the Q&A. But most importantly, you will have the opportunity to share your views and opinions in roundtable discussions that will follow every panel discussions. You will also have the chance to tweet your comments. And if you look at the program, that's where the hashtags are, okay? Together, we hope your ideas, wise counsel, suggestions, and critique will collectively advance the practice of public health advocacy and, as we at the Bloomberg School love to say, protect health and save lives and millions at a time. Before I introduce our first speaker, let me just explain why the chair for our other speaker is still vacant. Mark Suzman, the president of the Gates Foundation Global Policy and Country Programs, was called to an emergency meeting between 7 to 9 to discuss the concerted action on Ebola with the president of the World Bank and the UN Secretary General. He is on his way here and we hope he will arrive in time for his remarks. It is always a privilege and a joy to introduce the Dean of the Johns Hopkins Bloomberg School of Public Health, the oldest and largest independent graduate school of public health in the US, Dean Michael Clag. Dr. Clag is an internist and an epidemiologist who earned his medical degree at the University of Pennsylvania and his master's in public health degree from Johns Hopkins. He served as director of the Division of General Internal Medicine at the Johns Hopkins University School of Medicine and was the first vice dean for clinical investigation there. From 1998 to 2011, he also directed one of the longest running longitudinal studies in existence, the Precursor Study, which began in 1946. Dr. Clag has received numerous awards, including an honorary doctorate from Juniata College and the James Bruce Memorial Award for distinguished contributions in preventive medicine from the American College of Physicians in 2012. Dr. Klag's scientific contributions have been in the prevention and epidemiology of kidney disease, hypertension, and cardiovascular disease. He is the author of over 200 publications, was the editor-in-chief of the Johns Hopkins Family Health Book, and was chair of the NIH, that's the National Institute of Health, Advisory Board on Clinical Research, and the Association of Schools of Public Health. I had the opportunity to travel with Dean Klag in Indonesia this September. I must tell you that despite the tight schedule of back-to-back meetings from very early in the morning all the way to midnight, he made work for the staff enjoyable and fun. I noticed something odd, though. Every time we go to the field or every time the meeting is finished and we're in the car, he's always onto something. And I said, wow, this is really odd. So finally I discovered that what he's doing is actually tweeting. So I am pleased and happy to introduce the tweeting guru, Michael J. Klag.
Thank you, Oying. So I'm just about to send my first tweet, but I missed the hashtag. What's the hashtag for today?
Advocacy number 4, health.
Okay, excellent. Good. Well, thank you. And I was reflecting as you were talking, Oying, that we've shared the podium a lot. We've been at meetings, but never in the U.S. This is the first time that we've been together in the U.S. to talk, and so we've been Ethiopia, Indonesia, around the world. So thank you, and thank you for your leadership in bringing this, bringing us together. So I was tweeting when you were up there, and tweeting about how that you're opening this incredibly important session today, this advocacy forum, and to thank you for your leadership in bringing us together, and thank you for being able to get the Honorable Senator Ben Cardin here, colleagues, so many thought leaders and practitioners and champions, really, of health and advocacy to the school. We are limited in the number of people we could invite by the fire marshal. We know that's important, but hope that the folks in the overflow room can follow along. So our school was founded in 1916 with a grant from the Rockefeller Foundation, and so we're thinking a lot about that anniversary and how we celebrate it. And we'll start in July of this year, and we think about 25% of that celebration should be our history, and about 75% should be our future. And our future is going to rest on how well we do advocacy. So what do we do well as a school of public health? We generate evidence, we do research, right? We create the science and the facts that form the lever, the data with which we can move mountains. But if that data sits on the shelf, if that work gets published and collects dust, then we haven't done our entire job. Melinda Gates was here a couple of years ago, 2011, I guess, and for those of you who heard her speak, she spoke passionately about her commitment to improving the lives of people all over the world. And that made me reflect on this issue about advocacy, and I wrote a dean's letter about it. And in thinking about it, it goes back to the very beginning of our school. William Henry Welch was a scientist who believed that you needed to be a strong advocate for science and for the implications for health for all our work. And as I think about advocacy at our school, I think the person who, for me, really is the shining example of advocacy based on doing research and then advocating is Suzman Baker. So Suzman Baker, many of you know, she is a pioneer in injury prevention, and she discovered that there was a very high mortality for babies who were carried in their mother's arms in the front seat of cars. And so once she demonstrated that, she then worked tirelessly with many of the people in this room, Andrea Gielan, Ellen McKenzie, to change the law to require car seats. So that's why we have car seats. That's an example of the kind of effective advocacy that we're talking about today. But lots of folks in the school do advocacy, and of course, the biggest advocate for advocacy is Oying Rimon. And Oying has an incredible ability to get ministers of health, to get world leaders in a room, teach them about research and evidence, and then get them to make the next step to take actions. He can even get senators in the room. So we have a long history of advocacy here at the school, and evidence-based advocacy. And I see it as an extension of the research and the training of leaders that we do. So I think the advocacy group, they've come together to have this forum, and you heard about the structure. And I would say that what we hope to get out of this, and what we know that advocacy can accomplish, is to improve policy and laws, make sure they get implemented, increase the resources for health interventions, and make sure that they're used well, address issues of health equity that go beyond whether people have just access to care, but the social determinants of health that influence how we live, or the physical and social characteristics of our lives. And then getting the knowledge out there, making scientific data more easily accessible to policymakers and health. And I was at an advisory board meeting in New York a week ago, and at the end of my talk, somebody said to me, "You know what's the trouble with you scientists? Nobody can understand you." So that was pretty depressing to hear that, but it was good that he was being honest. And then, of course, I told him what was wrong with him. But then in advocacy, we want to shift behaviors and norms. So I know at the end of the day, you're going to come up for a roadmap of how we do that better at our school, and how we train people in advocacy and evaluate it. How we take the science of monitoring and evaluation, look at interventions, and come up and make even better interventions. So let me now introduce Senator Cardin. So I came to Maryland in 1984, and one of the things that Senator Cardin, I think, was then in the House of Representatives, and one of the things I was struck by was that when I would see our congressional delegation on TV, see our senators, I was struck with how reasoned they were, especially with what was going on in the country at that time. We had Reagan-naughts and whatnot. And since then, I've had that same impression time after time when I meet with our elected representatives, that we're very fortunate to have a group that are mature, that are smart, and that value evidence to make decisions. So Senator Cardin was first elected to the Senate in 2006, and now he's on the Foreign Relations Committee, Finance, including the Healthcare Subcommittee, Environment and Public Works, and Small Business Committees. He's been a voice for the most vulnerable citizens, not only in Maryland, but throughout the U.S. and the world. He's an advocate for fair treatment in the workplace, and he supported the Affordable Care Act because he believes the law benefits all Americans by reducing the cost of health care and providing families with affordable, quality health care without adding to the federal deficit. I remember the terrible tragedy we had in Maryland with the Diamante driver, who was a 12-year-old boy in Prince George's County who had a toothache, sought care. His mother took him to, I think he was in the hospital, went to hospital ERs twice. He couldn't get care, and he died of the resultant infection, the abscess. And the senator has been an advocate for the Diamante driver laws to increase access to care. The state-level laws increase access to care for dental care for poor people. He was responsible for elevating the Centers on Minority Health Disparities to the National Institute of Health because he believes that basic research is needed to understand the causes of disparity and develop new treatments and interventions to remove those disparities. He's been a strong advocate for increased funding for medical research, and just point out that our number one funder is NIH, so we appreciate that. He's been a strong advocate for world-class universities in Maryland, both the University of Maryland and private universities, and for our state's cutting-edge biotech industry. So he's really tried to focus this economy on new technology and improving health. In the House of Representatives, his bill to expand Medicare to include preventive benefits such as colorectal screening, mammogram, osteoporosis screening was enacted into law. Am I taking your talk? No, it's okay. Sorry. Yeah, and he was one of the authors of legislation to improve the Medicare drug benefit for seniors. So I could go on, but I would encourage you to look at the senator's website and the section about Ben. It's very well written, does a great job of explaining the incredible accomplishments he had. So please join me in welcoming Senator Ben Cardin.
Dean Clegg, thank you for that very generous introduction. You could have gone on. I'm not treated that nicely in Washington, so it's great to be here, and I have nothing but admiration for the leadership of Dean Clegg and what's done here at the school. I knew of all your skills and your background and all the academics that you were able to achieve, your leadership. I just didn't know about your ability on social media, so we might have a part-time job open for you in our office, so in case things don't go well for you. But you should know that Dean Clegg has a lot of influence, because when I was invited to be here, Oying, thank you very much for the invitation. I said we're never certain on our Senate schedule. As you know, things can always change in the United States Senate. But when Harry Reid, the majority leader of the United States Senate, heard that I was speaking here today, he made sure that we were in recess. So thank you very much for your influence there. And to get the Orioles to win in 3 straight so we didn't have an Oriole game today with all the traffic. Way to go, Dean. Give your Dean some credit here. He's right on target. It really is an honor to be here. The Bloomberg School of Public Health is the school in the country. Yes, you should brag about your almost 100-year history and what you've been able to do, from the introduction of vitamins in our society to safe drinking water, and the list goes on and on and on. And what you've done for the people of Baltimore City and what you've done for the people globally is incredible. So it really is an honor for me to be here today and to thank you so much, and to be with the people from the Gates Foundation. You're my heroes. And Beth, I thank you very much. And I was talking very briefly with Beth. I was at the United Nations General Assembly meeting with its startup just about a week ago. I am one of the 2 members of the United States Congress that's been appointed by the President to be part of our UN delegation. So I'm part of our delegation in New York, and I will be traveling to New York later this month as part of that. But I was there for the opening of the General Assembly and had a chance to visit with President Clinton and the Clinton Global Initiative and the people from the Gates Foundation to renew what we're going to be doing as to the next level of commitments globally to deal with the issues of humanitarian need. And in the last 20 years, one of the global initiatives was to reduce infant mortality rates, to increase infant survival rates. And when you have a day where you don't think you're doing very well, take a look at what you've done. What you've done because of the work done here and the work done by your colleagues around the world. In the last 20 years, we have saved 100 million babies that are now alive that would not be alive, but for the initiatives of working together to deal with some of the very simple solutions to infant survival. You know that. You've studied this. You know that in many respects it's just dealing with infection, dealing with respiratory issues, dealing with nutrition. It's not difficult to know how you can increase dramatically the survival rates of infants. And we've made that difference because of your work and work of colleagues like you around the world. But you can't rest because there are millions of babies dying every year that could be saved. So we're not there by any stretch of the imagination. So yes, Dean Clegg, 25% on the past, 75% on the future, that's the right ratio to what we need to do, working together. So 2 conclusions from my introduction. One, I am very proud to be the senator that represents the Bloomberg School of Public Health in the United States Senate, along with my colleague, Senator Barbara Mikulski, who shares your passion and is in a key position in the United States Senate. Here we go again with a little more social media. Please do it. It's good. Who shares your passion. Senator Mikulski and I are just so proud of being at meetings all over the United States Senate, all over the world, where the Bloomberg School of Public Health is mentioned as being a key partner in what is going on positive to advance the cause of humanitarian needs. So we're proud, number one, of what you've been able to do. We are proud of the Gates Foundation and what it's been able to do with its incredible influence in really making a huge difference in dealing with global health issues. So that's one conclusion. We can be proud. But the second is that we need your advocacy. We need your advocacy. So this day, I think, is devoted to the most critical need we have in advancing public health in America, and that is advocacy to take the best scientific information and make sure it's applied to the right policies in our country. You need a stronger federal partner. This is the values of America. Our values are exactly what you're doing. That's what our core beliefs are, that we should make sure that everyone has a fair shot at the wealth of this world. That's American value. We have the capacity. We're the wealthiest nation in the world. We have a political system that allows us to do so much. We have the leadership. We have the innovation. We have the institutions. We have the capacity to do a lot more than we're currently doing. And yes, it's in our national security interest to have a more sustainable global environment, to have people who have opportunity. They will be more willing to help in global issues if they have economic opportunity, if they have health, if they have food. If they have these basic necessities, we'll have a safer world. So this symposium dealing with how science and advocacy can not only coexist but thrive and grow stronger, you got my attention. You got my attention. Because I visit with a lot of lobbyists during my days in Washington, and that's wonderful. That's our system. We have the right to petition your government. That is fundamental to our constitutional system. So it's wonderful to have these high-powered lobbyists visit us on all these important interests to corporate America. But we need you in our political system as advocates for science being applied to the best policy that we possibly can. So this white paper that you will be talking about, a state-of-the-art advocacy institution at a leading university, it sounds like Hopkins. I don't know whether that was meant to be that or not. Having private partners such as the Gates Foundation, that seems like Gates Foundation. Seems like you got the right people here. And I hope you will give serious discussions as to how we can take the credibility of what you do and make it more effective in our political system. We desperately need that. The research must be translated into informed public policy and requires advocacy. Lord Kelvin said that life and soul of science is practical application. And your great dean said advocacy must rest on a solid scientific foundation. And they're truths. So let's just take a look at some of the things Dean Clag, in introducing me, mentioned the DeMonte Driver circumstance, a 12-year-old in 2007 living in the state of Maryland, not more than about 30 miles from here, couldn't get access to a dentist. His mom tried. His mom called dentists, didn't have any insurance, had no way to pay for the dental care. Now, he needed $80 worth of dental care. His tooth became abscessed, went into his brain, went through 2 surgeries, cost $250,000, and he lost his life. What a tragedy. What a loss of life, tragedy, cost, tragedy. Preventable, totally preventable. We took action after that. We had advocates that said, no more, not under our watch. We're not going to let it happen. And as a result, since 2007, in about a 6-year period, we've doubled the number of low-income families whose children are currently being seen by dentists. That's a pretty impressive number. That's an impressive number. Thank you. That's public advocacy. It wasn't done because of me. I couldn't have gotten it done in our political system unless I had you. Advocacy made a huge difference. The work done here at Hopkins with the WIC program, the basic importance to what we can do with women, infant, and children. Over 8 million women, infants, and children are benefiting from that today because of your scientific work, but you didn't stop there. You then got that information out, and the advocacy turned into a national program, and that program is helping every day. Give yourselves a round of applause. You got that done. You did it. So let me talk about another example of what works, and it started with that big spending president we had named Ronald Reagan. PEPFAR, HIV/AIDS. Wasn't too long ago we thought this was going to destroy the world. Think about it. We looked at the numbers, couldn't possibly stop it, but then you and your colleagues around the world said, we have an answer. We can control this. We can bend the curve, and we can cure AIDS. You said it. But you need to make a consequential investment to do that. It's not going to happen if you have a country that doesn't have the basic medical access to make it work. So that's going to require millions and millions of dollars investment in one country. You can't just have a program that spends 10 or 20 or 50 or $100 million, but just spreads it around and doesn't really do much. Make a consequential change. And we did. And the Congress passed it. And look at the numbers today. It's worked. It's continuing to work. The numbers are dramatically different today. And now we do believe we can cure AIDS. When we said it when Ronald Reagan was president, I don't think too many people really believed it would be possible. But we did it. So we got great challenges ahead of us. Ebola, great challenge. Yet you know that in the countries where it's not under control, it could be under control. Science has taught you exactly what needs to be done and how to implement that. We have not yet converted that into policy. That's our failure. Do we have to wait for a crisis like Ebola before we had reasonable health access in African countries that are now suffering from the spread of Ebola? It's our fault, the global community's fault. We should have had those facilities in place. So let's work together on advocacy so we can make sure that every country in the world has the basic ability to provide health care to its people. Dean Clegg mentioned the fact that we now have a National Institute for Minority Health and Health Disparities at the National Institutes of Health. I'm particularly proud about that because it was part of the Affordable Care Act. You hear a lot about the Affordable Care Act. You used to hear a lot more. You don't hear that much about it today because politically it's not a liability, so Republicans aren't bringing it up quite as much. That's my last political note of the day. But in the Affordable Care Act, there were a lot of good things. And one was an amendment I offered to elevate the Center for National Health and Health Disparities to a full institute at the National Institutes of Health. I did that because I recognized the historic discriminations in our society, and we had to do something about that. And it financed a study in my hometown of Baltimore. And in Baltimore, they did a study that looked at the life expectancy of people based upon their zip codes. And there was a 30-year difference depending on where you live in Baltimore as to your life expectancy. That's a generation. You all know why. You've done this study. You've done the scientific work. You understand the risks dealing with guns and dealing with housing and dealing with access to healthy foods and dealing with opportunity in schools. You know what the reasons. There's not one reason. You understand that. And yet, we haven't translated that into policy because it's the same old political debates. We need you as advocates telling us how you can change that. Americans believe in a fair shot for everyone. We're not getting that in Baltimore. Our political leaders want it, but they need an advocacy to show us how we can do it, combining science with policy. You can get that done. It can work. We have in Washington what we call the climate science deniers. If I had to mention one global issue that I think could really have just catastrophic impact that we're not paying attention to as much as we need to, it's what we're doing here on Earth on climate, on our greenhouse gas emissions, and the fact that the globe is warming too quickly, the impact it will have. We're seeing right now in southern Florida, the southern Florida flood. We look at our military facilities located along our coast, and we are already making certain preparations that those facilities won't be there in a relatively short period of time. From the climate refugees that we have today around the world causing instability in many countries, to the extreme weather conditions and the catastrophic impacts that it's having. I just go on and on and on. So another opportunity for those that have been so engaged on the science. I'm reminded that about 98 to 99% of the scientists all agree that there is a way to do a much better job on the consequences of climate change. That what we do here on Earth makes a huge difference. Investing in renewable energies, less energy use, all these things will make a huge difference. About 98% agree. And I was reminded that if you went to a doctor and he told you you had pneumonia, and if you do certain things, you have a 98% is the best way to go, you're going to follow that doctor's advice. Yet we're not doing that with the scientific information on climate. Once again, it's a failure because those of us who serve in public life don't have enough support among our political constituencies to get this done. Yes, they agree with us, but they're not engaged. It's not a priority to them. Most Americans agree we should do something, but it's not yet a political reality we can get it done. And advocacy based within a university or based within those who have the highest credibility can make a huge difference here. And the urgency, which is what you need to do. It's not just about advocacy, it's about the urgency of the issues that you choose to pick on advocacy. This can clearly be a win-win-win situation because if we deal with the climate change issue from the point of view of our environment, we also grow our economy. We make our country more energy secure, which is more national security for our country. So we can do much better on the science you already know, and applying that to better policy here in this country. We can save lives, we can save costs, and we can strengthen our economy. So let me talk about priority number one. Priority number one today for me is how much money are we going to put out on these programs? You can have all the discussion you want, but when you have 3 years of frozen budgets, there isn't a lot of area where you can initiate new changes, and a lot of what you want done involves investments of funds. We saw that in the PEPFAR program, as I mentioned before. PEPFAR would not have been a success but for the a willingness of the United States to lead in putting forward a significant amount of public resources. And yet today, in international development assistance, the United States invests less than 1% of its total federal budget. Now, that's not a lot. Many countries devote a lot more than we do of their budget. So the funding issues become pretty important. The NIH budget that Dean Klag mentioned, it's been frozen now for a couple years, virtually no growth. Less than 1 out of every 10 worthwhile projects are funded. Less than 1 out of 10. So 9 out of 10 are not being funded. Just think about how much further behind we are on scientific research. Just maybe we would have started on the Ebola issue before we did. I don't know. We have an influenza vaccine, so you don't have to have the annual shot. That's pretty close to being ready for market. Well, maybe because NIH isn't adequately funded, it'll be another year delay before that comes out. A year delay in influenza, think of all the lives that could have been saved. You all got to make the connections here. We should be doubling the NIH budget. And it would create a lot more jobs. We're America. We can do it. We need your help on this. So first, no more government shutdowns, no more sequestration, and no more continuing resolutions. You can't run a government that way. So how do you get there? We need reasonable, predictable, growing budgets that invest in what's important for America to reach its full potential on these critically important areas. Now, to be an effective advocate, you've got to do more than just say, I have the answer to a problem, now you should make that a reality. Because everybody will agree. We're happy that you tell us that if we increase or eliminate these food deserts and people have healthier foods and you get them on their table, this translates into less visits to the doctor, and you can give us the dollar amounts on how much we're going to save. Okay, we agree with you. But we don't have any more money right now. Where are you going to take the money away from? So you also have to understand the political realities in which we're living in. And on funding, the political realities tell us that we have to have a much more balanced approach to how we do our budgeting in Washington. The federal government is the major partner here. You see, we spend more time dealing with what we call discretionary spending, which is what you care about. That's where your money comes from. That's where research comes from. That's where international development programs come from. That's where our health initiatives come from the discretionary side of the budget. It's been frozen for about 3 years now. And under sequestration, it would be reduced. So you need to be engaged in the other two major parts of the federal budget. So if you're advocating for more money to deal with nutrition, you have to understand that we have to control the mandatory spending, and we have to have the revenues in order to pay for things. So you need to be engaged in that part of the debate also. That's all part of it. You just can't stick to your narrow interest. You have to be able to be engaged. And it is correct that mandatory spending is rising too quickly. I think we have a handle on that. I think the Affordable Care Act, which is health care costs, which is the largest part of mandatory spending, that the delivery system changes that we are putting in place will make a huge difference. In Maryland, our hospital waiver program, which is innovative and new, will really bend the cost curve for hospital costs in our state. We're doing amazing things to reduce readmissions and to keep people healthier. All that, I think, will work. So we've got to stay on top of that to make sure that we really do reduce the mandatory spending and growth in this country. But you also need revenues. And to get revenues, you got to reform our tax code to make our tax code work. I have an idea on that. Invite me back for another symposium, those of you who are interested in taxes, and we'll talk about taxes. But you got to understand that. So when you get involved in advocacy, it doesn't stop with your special interest or your passion on the particular policy change. You have to figure out how you can get it done within our political environment. to help you have to help us establish the funding priorities, and this is important. There are so many problems in the world. Dean was telling me every day he gets another issue he talks about. You got to help us determine where is the most likely way we can make progress. And there you have to look at the urgency of the issue, the likelihood that the policy will make a difference, and the political reality of getting that policy adopted. I mean, you have to evaluate that. And you got to be honest. Might be your passion, but the science just isn't quite as clear on results, or the costs are just too high, or the political hurdles are just too fundamental to make those types of changes. You got to be realistic about it. I'll give you a couple areas where I think you can do things. You need to leverage public-private partnerships. You can't just come to government and say, do a problem. If you can leverage it with the private sector, you're going to be able to get more attention, plus more political support to get it done. If you have a company or a university or a foundation that's with you on it, it's more likely that you'll get a federal partnership, because we know we're not in it alone. We know others have evaluated it, and others believe there's a good return here. That's exactly what Administrator Shaw is doing with foreign development assistance. Administrator Shaw is the administrator of the USAID, the principal agency that administers our international development assistance. He has these global development labs. I hope you're all familiar with it, because he's taking our universities that are already in the countries that we're trying to make a difference, working in partnership with the universities and private companies that see a market in these developing countries, and leveraging a small amount of federal funds and making it a stronger program to develop capacity within a country. It works whether we're talking about agriculture, whether we're talking about healthcare, whether we're talking about housing, whether we're talking about transportation. In each of these areas, the expertises that we have in universities and in private companies who want markets, and the federal government who can help in that regard. Support that effort. It's just getting off the ground, and I think it's very exciting, and I think that will help. Get engaged in this debate that we're having in Washington as to where we spend your national security dollars. It's the largest part of our federal budget, is our national security budget. National security budget is Department of Defense, it's the State Department, and it's development assistance. We do it through diplomacy, we do it through development aid, and we do it through our soldiers and our weapons. That's our national security budget. Well, as you probably are aware, we spend about 10 times more on soldiers and weapons than we do on diplomacy and development assistance. I would argue that that may not be the healthiest balance for our country. In fact, it's probably about 20 to 1. That we should be looking at root causes of problems. And I'll just give you some examples of, we've seen the cost to the American taxpayer and to the loss of life in our involvement in Iraq. Now, I didn't support our military involvement in Iraq in 2002. I didn't see where they were involved in the attack on our country. But we went there to get rid of extremists. Extremists are still there. And we have spent hundreds of billions, $1 trillion, and lost thousands of lives. Now we have ISIL. What are we doing about ISIL? Yes, there's a military answer to ISIL and trying to root it out. We've seen that ground troops alone won't work because we tried ground troops. We've seen ground troops and air support will not work because we've tried that in the past. The way to end ISIL is to cut off their support from the point of view of financial and political. How do you cut off their support? Give hope to moderate Sunnis that there's opportunity for their children. That can be done through development assistance and opportunity. Look at how you can use the tools, why people act the way they do. I know of very few parents who don't want a good future for their children. The same lesson can be learned in the Middle East. Now, I'm a strong supporter that Israel must have a demilitarized Gaza so that it doesn't have to send missiles in to take out missiles that are aimed at their country, which any country would do. But Hamas's support in large measure is because Palestinians see no other future. Development assistance for the Palestinians can make a huge difference in cutting off the support of Hamas so that we finally can have peace between Israel and the Palestinians. And I could give you many, many more examples. Let me just conclude on one final example in which I think science tells us the answers. You know of the issues on our borders. The unaccompanied children who have been coming up to our borders, it must be a horrible choice that parents have to make in El Salvador, Honduras, and Guatemala. Do you leave our child in the host country and get caught up in gangs and may get murdered? Or do we send them on a journey to the United States border where they may not make it because of the traffickers? Or if they get there, they don't know what's going to happen to them, whether they'll be able to get into our country or not. Horrible choice. I can tell you that we're spending hundreds and hundreds of millions of dollars at our borders to deal with this. In border security, in dealing with the unaccompanied children when they reach our borders, to house and to take care of them, the legal procedures, and I go on and on and on, the cost. Wouldn't it make more sense to do a PEPFAR type of a commitment to help these three countries rid their countries of these gangs and to give hope to families? Wouldn't that make more sense? So your advocacy can help us with those types of judgments that we make every day where I work in Washington. And again, there are many, many more examples that we can give where you can make a consequential difference. And you have, as I started with all the different examples of where you have made differences. And that's why I am so excited about this symposium. And as I look through this room, you give me great optimism. I see a lot of young people here who are here for all the right reasons. You're here because, as I said in the beginning, the value of America is every person should have a fair shot at opportunity. And you're trying to make that happen. You took Dr. King's admonition to heart, where he said each one of us is here for a purpose. Each one of us can make a difference. But he also implied that if you join together and work together, you can really bring about change. And that's what you're doing today. And I am proud to represent you in the United States Senate. Thank you all very much. You want me to take? I don't want to keep you behind schedule.
No, we're fine,
Again, that's a different response than Washington. I have time for a few friendly questions. Any questions are fine. If you have questions, we want to get you back on schedule. I know we're a little bit running late, but if you have a question or two, I will be glad. It's always hard for the first person to stand up. I'm being told to cut it, end it, right? We're behind schedule? We're okay? It's always the first person to ask the question usually gets free tuition for a year. That's what that's what I heard it was. Can I ask a question? Sure. You don't get the free tuition. Yeah. I think David Obey has a point. I think there's been a void in American politics. The Tea Party is not monolithic. It represents some libertarians. It represents some right-wing extremists, anarchists. It represents people who are just fed up with what's going on, looking for something different. It represents people who have had a bad experience with government. I mean, there's a lot of different groups that are represented by the Tea Party. as President Obama says, he looks at this movement as someone who has a fever. It's got to break at some point. And that will get back to what I think most Americans want, which is moderate policy. And that is they want us to come together to reach compromise. The difficulty with the Tea Party believers is that they believe that gridlock is success. Yep. So they're not upset when nothing gets done. I would like to see policies passed that represent my views. But I recognize this Congress is not made up of a majority that represent my views in both the House and the Senate. Therefore, I need to sit down with people who I disagree with on policy and find common ground. We did that on immigration reform. It was not the bill I would have drafted by any stretch of the imagination, but it's one I strongly support because it represents tremendous progress within the political environment in which we live. That's what we have to do in the budget. And I am working with Republicans. And the majority of the members of the Senate, I believe, are strong believers of what I just said on both sides of the aisle. So you got to come together. Don't let any of us off the hook. I mean, look, the elections are in November. Not much is going to happen in the next 4 weeks. We'll have an election. Don't let, on the second week of November, people tell you we're already into the next election. Let's get our work done. Let's get together and work together and figure out a common agenda. Americans want us to do that. The overwhelming majority want us to do that. And I think we have the majority of the members of Congress who would like to see that done. It's now up to our political leaders to make sure that happens. Yes.
I really like the point you made about moving beyond the discretionary part of the budget and looking at the other two areas. We don't hear any talk about the revenue side. And looking at the political realities, what do you think could actually get done on the revenue side?
Well, as I said, you're going to have to invite me back for another. It's a long discussion. But I will introduce a bill in November or December that will recognize the fact that America, of all the industrial nations in the world, you all should know this for your work globally, we're the least socialized. In other words, we provide less governmental services than just about every other industrial nation in the world. So why do we have the highest marginal tax rates in the industrial world? Why are we out of competition on taxes? And the reason, of course, we're stubborn. We do it our way. The rest of the world does it a different way. We're the only country that doesn't rely on national consumption taxes. And we have high income taxes. So what we really need in America is a progressive consumption tax, which would be fairer to middle income families than our current tax code and allow us to produce the revenue we need to pay our bills. Now, absent that, can you reform the current tax code? It's difficult because so many members won't vote for anything that looks like a tax increase. So that makes it difficult to work within the current framework to get something done. And when you work within the current framework, people are losers and winners, and it's very difficult politically to get this done. So it's a real challenge. We will work on transportation and on energy to try to get revenues directly related to that subject, and we may be able to get it done. We may be able to pass a transportation bill. We may be able to pass an energy bill. But we need fundamental tax reform. And I think
Thank you very much, Senator Cardin. My name is Gary Newton. I'm working with Save the Children.
Thank
I live
you.
in Washington, D.C. If I lived here, I would vote for you early and often. Thank you very much for your leadership, and I just wanted to offer a point on PEPFAR, the President's Emergency Plan for AIDS Relief, which you rightly pointed out has been, by many, many measures, a great success. I worked for USAID. I had the good fortune to work for USAID for 25 years. I worked on PEPFAR in a couple of African countries, and I would just like to relate PEPFAR to the good work that's going on here today and in the future at Hopkins with Gates' support on advocacy. I think that it's tremendously important to support local advocates, perhaps some of the leaders here from 14 countries and others, to advocate within their respective political milieu for their governments to incrementally assume more and more of the recurrent costs of the prevention care and treatment programs the U.S. taxpayer has been supporting, particularly the treatment programs. And that's a huge advocacy opportunity and challenge that entails using evidence-based advocacy.
Yes.
We apply the evidence-based standard to all manner of technical interventions within the world of PEPFAR and child health, for example. But what's so exciting about this meeting, as I understand it, is that we're focusing on how to do advocacy in a more empirical way, more evidence-based way. So I would just assume that you know the issue that I'm discussing, the importance of sustaining with local revenue. And it's there, as you may know,
Yes.
there are trillions of dollars in tax revenue in developing countries that have been collected over the, from 2001 to 2007. From 1 trillion to 7 trillion, the equivalent of US dollars have been raised in tax revenue. What is that revenue being spent on? We hope that it's being spent more and more through better advocacy on HIV/AIDS prevention, care, and treatment, on children, and other good things. Thank you for your leadership.
Thank you. And thank you on Save the Children's done incredible work. I visited with Save the Children when I was up at the UN General Assembly. Mark Schreiber's doing a great job in our state of Maryland. He's an incredible advocate on your behalf. Look at how Mark Schreiber lobbies, and you got a good advocate, the model to follow. He's very effective in his lobbying. Let me just give you, you're exactly right. I'll give you one example. Vietnam is a PEPFAR country, yet I chair the East Asia and Pacific subcommittee of the Senate Foreign Relations Committee. So it's the only PEPFAR country that comes under my subcommittee. I looked at the numbers and I said, why is it getting PEPFAR funds? Because the AIDS numbers just aren't very high. And I met with USAID on this, and we have a strategy. Our strategy is to leverage this, plus our interest in a closer relationship with Vietnam, the Trans-Pacific Partnership, a trade agreement that is moving forward with Vietnam, as well as military to military contact between Vietnam and the United States. We probably have a closer relationship with Vietnam than any of the other two major powers, China or Russia. So it is, we're leveraging a relationship. But what we're doing is using the PEPFAR funds along with local funds to build a health network within Vietnam that will sustain any type of health problems, not just HIV/AIDS, that gives you the capacity to really deal with sustainable health delivery in its country. And it's tied in to some of the agriculture and some of the economic development issues and some of the other issues in Vietnam. So you're exactly right. What we want to do is leave a legacy in these countries, and that means they have to take over responsibility. You know, one of my big faults about Iraq is we never built the capacity for them to take care of their own needs. You've got to build the capacity to take care of their own needs. So they have to be able to start devoting more and more resources. One last point. Another related issue to this is what Senator Lugar and I did on transparency, on extractive industries. We want the wealth of these countries. In many cases, they have wealth. It's just been used for corruption. We want that wealth to go to the people. So part of our engagement, and by the way, the Gates Foundation is very good on this, and the Clinton Foundation are very good on this, is to make sure that the local resources are being used appropriately for sustainable activities within the countries in which we are involved with. And that is, you're exactly right. If you don't do that, all you're doing is a patchwork. It'll never give the permanency that you need in these countries. Let me just, again, thank you all so much for your devotions to public health and to advocacy. We desperately need you, and you give us great hope for the future. I am optimistic that we will be able to continue to lead the world. And when you do your 200th, you will again take 25% for the history and 75% for the vision, and we'll have a great record during the next 100 years. Thank you all very much.
This is important.
Wasn't that a most inspirational talk from our senator? Would you agree with me? Yeah. Just in time. As I told you earlier this morning, our next speaker was called for an emergency meeting with the Secretary General of the UN and the President of the World Bank this morning for a concerted discussion and effort on the Ebola crisis. But he was able to make it just in time. Thank you very much. So I am really honored to introduce my former big boss at the Gates Foundation. Mark Suzman is the President of Global Policy, Advocacy, and Country Programs. And as such, he leads the Foundation's efforts to build strategic relationships with governments, private philanthropists, or sometimes called the high net worth individuals, and other key partners to increase awareness, action, resources devoted to global development and health. He also oversees the Foundation's regional presence in Europe, Africa, China, India, as well as a grant portfolio supporting cross-cutting policy research, advocacy, and selected country-level delivery efforts. Mark joined the Foundation in 2007 as Director of Global Policy, Advocacy, and Special Initiatives. In 2012, he was appointed President of Global Policy, Advocacy, and Country Programs. I was still at the Foundation at the time. Prior to joining the Foundation in 2007, Mark held multiple positions at the UN, including Senior Advisor for Policy and Strategic Communication in the Office of the Secretary General, Policy Director of the Office of the Administrator of UNDP, and prior to working for the UN, I like this because I used to be a journalist too. He was a correspondent for the Financial Times in Joburg, London, and Washington, D.C. Originally from South Africa, Mark holds a doctorate in international relations from Oxford University, where he was a Rhodes Scholar. He earned his bachelor's degree, summa cum laude, from Harvard University. In my experience working with Mark, I was always in awe at the clarity of his thinking, no matter how nuanced it was, in his ability to cut through the complexity and the clutter. Friends and colleagues, Mark Suzman of the Gates Foundation.
Well, thank you, Oying, for that very kind introduction and the invitation to join you all today. And just a word on Oying. He may have called me his big boss, but I felt all the time he was also my boss in terms of having been such a pioneer in the field of public health advocacy, especially around family planning, and many of the tools and lessons that we take, and I'll talk about a little bit today in other areas, are ones that he really helped pioneer in the space, so you're very lucky to have him here. Dean Clag, Senator Cardin, friends and colleagues, as Oying said, I apologize for being late, but what I was late for was an emergency meeting on the Ebola response that was called for this morning by the Secretary General and President Jim Kim of the World Bank. And we actually had the three leaders, one in person, the President of Guinea, and two on video conference, the Presidents of Sierra Leone and Liberia, of the three affected countries, speaking. And it was a powerful reminder of, just again, the critical importance of how you use messaging to drive responses to global health crises. This is a particular challenging one, obviously, and I'm very happy to come back to it in the Q&A section. But one of the things that really struck me during the conversation there was the balance we have to have between we're late as a global community in terms of really scaling up a response there, and so you need to fire up the advocacy to generate sort of resources and people and personnel coordination, logistics, and that is, again, where advocacy comes in, because it helps generate that. But while keeping perspective, the risk, and it came up, and the finance minister of Nigeria, Ngozi Okonjo-Iweala, was there speaking very articulately, is you also risk, as you drive up that energy, do you start mixing your money? There's a vision of an entire region with a disease sweeping across it. She was citing how health insurance companies have started canceling coverage for people who are going on just regular business trips to other countries in the region that are not affected by it. That you get the collateral economic impact. So the balance between calling attention to a crisis and then what's a smart kind of targeted response and how to do it, that's at the balance of all important advocacy, and we're facing it in very real time in Ebola. And I said we can come back to that in the questions, and tragic though it is, it does also highlight, particularly in the 3 affected countries, many of the wider systemic challenges that we're facing in health today. And it's important, though, to keep perspective, that despite that, and despite the very real and ongoing devastation going on there, the past 15 years have been arguably the 15 years that have seen the greatest successes ever in global health. Child mortality is down nearly 50% since 1990. Maternal mortality has dropped by nearly the same amount. HIV, TB, and malaria have decreased by 40%. And while obviously the proximate cause for those improvements has been direct interventions, from greater vaccination rates to wider distributions of ARVs, I would argue that increasingly smart, targeted advocacy at both the global and national levels has been a critical indirect cause. Most notably, the Millennium Development Goals, which were set in 2000 at the UN, set clear, measurable targets with a deadline, 2015, next year, to reduce maternal and child mortality by set targets, to reduce child mortality by 2/3 and maternal mortality by 3/4, and to slow the spread of HIV/AIDS. These provided a clear framework that allowed advocates to push for and hold governments accountable for delivery and execution. Indeed, a new paper that came out just last month that compared the trends in decline of child mortality from before the MDGs, so this is the period between 1990 to 2000, and it actually goes into a couple of different scenarios, to after they were adopted, suggests that at least 7.5 million extra lives, and perhaps as many as 14 million, have already been saved that would not have been had we not had that kind of framework, which is essentially an advocacy framework. Now, it's tough to do those one of the challenges with advocacy is how do you draw the connection between that kind of targeted goal setting attention and the outputs. But this is about as good a test as you can do, and we have very clear answers. And so that's why 2015, as we head into it, is such a pivotal year, because the global community will be formulating a new plan for action around this. And even as the agenda widens, as seems very likely, it's critical for us all to try and make sure that it retains at its core a succinct set of easy-to-understand health targets similar to the ones in the current MDGs. That's key to achieving the goal of largely eliminating inequity in health outcomes between rich and poor countries, as set out in the recent Lancet Commission on Investing in Health, which I hope most of you are aware of, and those who aren't, I encourage you to look at, because it is itself a very powerful advocacy tool that makes a persuasive case of the wider economic benefits of smart investments in health. And as it happens, 2015 is also going to be the 15th anniversary of the Bill and Melinda Gates Foundation. So what I really would like to do today is use a couple of examples to basically reflect on our own journey in global health and share some of what we learned about how public health advocacy can help reinforce and drive results and outcomes in key areas. Like as Oying's already mentioned, I came to the foundation in 2007 after 7 years at the United Nations, where I was actually involved in the development, the original development of the MDGs. And what drew me to move from the East Coast to the Pacific Northwest, which seemed on the surface very far away from the problems in Africa and Asia and elsewhere we were trying to solve, was the sense that there was a real opportunity at the foundation to make a difference at the institution that had some more flexibility and a more targeted focus on achieving impact in key areas. In fact, Bill and Melinda started the foundation with a very simple but powerful promise that every person should have the right to a healthy and productive life. And outside the US, our focus is on identifying critical gaps in health and development where we can make a catalytic difference. We try not to replicate good work that others are doing. We're not a boots-on-the-ground organization, although we do have some modest presence in different regions, as Oying referenced. But our real opportunity to serve as a catalyst, to be a little bit of an honest broker, a convener. Can we bring ideas? Can we leverage our resources? Can we leverage our partners in order to get results that are far bigger than what we would be able to do if we simply work directly? And much of our agenda is focused on global health. Strategies, investments, obviously in key areas like family planning, nutrition, maternal health, newborn child health, vaccines. And vaccines is one of the examples I'd really like to focus on today, because it's our single largest area of investment, and we believe that vaccines are one of the best buys in global health. The story of how we got involved in vaccines is interesting. In 1997, Bill and Melinda were reading the newspaper and came across a pie chart breaking down the major causes of death among children. And they were very surprised to learn that one of the biggest causes of death, killing 500,000 children a year, was rotavirus, a disease they hadn't even heard of. Now, simply the fact that that was in a newspaper article, which is itself, as a former journalist, a form of advocacy, shows you how, first and foremost, getting information out is the key to getting results and outcomes and getting clear information. And what affected them very deeply was that most of those 500,000 children died because they lived in countries that simply didn't have access to basic either, there wasn't a vaccine at that stage, but even the treatments, oral rehydration, salts, other very basic treatments weren't available. At the time, Bill was in his early 40s, Melinda in her mid-30s. Bill was still running Microsoft, and they were starting a family. They had planned to do philanthropy later, at some future stage. But as Bill said recently, seeing that pie chart back in 1997 set him on fire. And when they realized that researchers were testing a vaccine to protect children from rotavirus, Bill and Melinda decided to do everything they could to help drive that vaccine production forward and get it to every child who needed it. And as they got more engaged, it became clear it's not simply about technology, but it's delivery. How do you get the systems and the evidence and the policy guidance to help countries and governments, donors and developing countries understand what to invest in? And then also, how do you bring the cost down? These are expensive, so that you can actually reach as many children as possible. These challenges led to the foundation to provide seed money to create Gavi, the Vaccine Alliance. The basic theory of Gavi, which I hope many of you are familiar with, is relatively simple. Just align the efforts and resources and expertise of governments, the private sector, and multilateral organizations so that everybody is pulling from the same end of the rope against this critically important goal. And more specifically, by actually pooling the financial resources of donors and the demand for vaccines, we're able to increase capacity and competitiveness of manufacturers and drive down costs. That spurred manufacturers to offer vaccine at unprecedented prices. In just a 2-year period, the cost of immunizing a child with pentavalent pneumococcal and rotavirus vaccines has gone down by 35%. So since its inception now, 14 years ago, the Alliance has helped developing countries reach an additional 440 million children with life-saving vaccines, averting an estimated 6 million deaths. Today, 32 of the world's poorest countries are now scheduled to give that rotavirus vaccine, which didn't exist back then when Bill and Melinda read the article, and that number is going to climb to 40 by next year. But we know nothing in global health is ever simple. Many developing countries still struggle to afford vaccines, and Gavi's impact relies on its ability to actually mobilize those resources from donor governments. And that's an area where advocacy, again, is absolutely essential. To tell Gavi's story, which I think is one of the most powerful stories there is in global health, and why it's such an incredibly cost-effective investment in terms of lives saved. To help get that message out, the Foundation both speaks and advocates directly. We partner with Gavi, who themselves obviously speak to their own results. And we also fund advocacy partners, from the One Campaign to the UN Foundation to Save the Children, all of them share those goals to how do we generate real constituencies of support, both among the general public and among key policymakers. And that's all critical to helping make sure that donors do step up. And 3 years ago, we saw the results when Gavi held a pledging conference, and a conference that was hosted by the UK government, who's played a real leadership role in this space. And $4.3 billion was raised then, enough to immunize more than 250 million more children. And this January, we now have another moment, because these replenishment rounds come every 3 years, and it's a tough period in 3 years because of the state of the global economy, and particularly the economy of most traditional donors. But we're hoping with the German government on January 27th to raise even more money. We hope up to around $7.5 billion for an even more ambitious target to reach more kids, but also we now have more vaccines. The flip side of developing new vaccines against it is we then have more opportunities to save more lives. So your sticker goes up, but the impact is much wider. But that's still a very tricky case to make when you're going around government by government and you have new challenges. For example, the Ebola response I just cited. I know there's some real nervousness that the reality is money that's critically needed and should go to Ebola now divert away from a kind of long-term investment that we need in Gavi and coming up in a couple of months. And how do we manage to do both and create the demand and understand the need for both? And that's also essential on sort of developing countries. Surprising as it may sound, when Gavi was first ramping up support for these vaccines, it wasn't clear there was enough country demand, despite vaccines being one of the most cost-effective interventions around. And since they were being rolled out faster than ever, many policymakers just didn't have a clear understanding of impact. So to address this challenge, we've also worked to provide sort of collateral research on that effectiveness and necessity, research that can go not just to health ministries, but also to finance ministries and heads of state and be used in local media. And the goal is to educate decision makers on that impact. And I think we do now have a powerful constituency of champions. But even on something as clear-cut as that, it's still a continued heavy lift where you need this kind of targeted advocacy. A second area which I wanted to highlight today, where we invest very heavily, is polio. Here too, there's another global partnership, the Global Polio Eradication Initiative, which tries to align the needs of polio-endemic countries. Polio remains endemic in 3 countries, Nigeria, Afghanistan, and Pakistan, although there are, in fact, last year saw some repeated outbreaks in areas from Syria to Somalia to Cameroon and Equatorial Guinea. And as long as you have these endemic centers, you will continue to have outbreaks, and that requires vaccinations to happen everywhere. Eradicating the second human disease, which this would be, smallpox was the first, is a daunting task, but it's a hugely important one. There have been lots of setbacks in recent years. The 3 endemic countries, obviously the problems are as much political and security as they are logistical. You have the tragic deaths and killings of polio vaccination workers in Pakistan. You have the Boko Haram challenge in northern Nigeria. But there have been remarkable achievements too. India stopping polio has been one of the great signature triumphs in the last few years. It was actually long thought that India would be the most difficult country to stop because it's so large and so porous, and actually they have, and they've been certified polio-free for 3 years now. And we're also now very encouraged in Africa. This year, polio cases have decreased 90% from last year. So far this year, there have only been 6 cases in Nigeria compared to 47 last year. But it's still a very difficult message to when you're talking to donors, because on the other hand, you go, but you're trying to mobilize billions of dollars for 6 cases, compared to hundreds of thousands of millions of people in malaria or something. What are those trade-offs? And so you have to, again, make the case and explain that actually there are real-time costs. As long as there's any polio in the world, then everybody needs to keep being vaccinated. And those vaccination costs are huge. You have to pay for continued campaigns. So the long-term savings of not having to do these annual vaccination campaigns over time will far outweigh the short-term costs. But if you actually look at it as $1 per life saved right now, it seems completely out of whack. And bizarrely, the foundation's very proud of it, but we're actually the largest single funders. We fund more than any government right now to the Global Polio Eradication Initiative, which, that's part of a personal passion for Bill and Melinda, but I also think it's frankly a little bizarre. We're a powerful foundation, but governments really should be. And many governments do support this issue, but it's part of that challenge. They look at the trade-offs and it's difficult to understand those. So we've had to work, and in fact last year helped convene a global vaccine summit in Abu Dhabi, which was trying to both highlight the critical importance of polio, bring in new donors, especially some in the Middle East, like Abu Dhabi, that has been a generous contributor and is working in Pakistan, and new voices and champions, use unconventional private sector voice. Aliko Dangote, the richest man in Africa, a very successful Nigerian businessman, has become deeply involved in the Nigerian effort and has a very powerful, credible voice and uses his own foundation, and that's part of the success we're seeing in Nigeria, has been very much about mobilizing new actors like him to get involved. We've also had other influential business leaders. Bloomberg has contributed a $100 million commitment to the Global Polio Eradication Initiative. Carlos Slim, the Mexican telecoms billionaire, has done the same. And so it's got getting in some of these unlikely actors as part of the thing helps actually generate and give new momentum to a story which, frankly, when I wander around, many people in this country go, oh, I thought polio was over. really? We still need to fund it? We haven't had a case here in decades. And so you've also got to correct that perception. But like my Ebola example, make sure you don't, when there are spreads, as there were to Syria, then overstate the case and say, oh my gosh, it's all falling apart. We're losing momentum, because actually we're closer than we ever have been. There's a very real chance with those Africans that Africa could become polio-free within the next year, and then we would be down to just one region, Pakistan and Afghanistan, and the Pakistan-Afghanistan border. But that's all sort of so difficult and challenging to keep those coalitions together and driving, because energy flags when they go, oh, it's still there, we thought it was going to end. And let me close with a final example I want to do, which also relevant here, is tobacco. And I could use lots, but tobacco is pretty interesting, because here again, our involvement in tobacco advocacy started with an article Bill read. Bill reads a lot. This one was a 2006 piece in the Disease Control Priorities in Developing Countries, which I'm sure you all keep on your bedside table, about the growing public health burden associated with tobacco use. And the article there projected a doubling of tobacco deaths to 10 million annually by 2030, and 1 billion deaths this century, mostly in developing countries. So building on the important investments already been made by others, Bill saw the potential for the foundation to help prevent an epidemic, particularly in Africa, where consumption was fairly low at the time and the foundation was already doing a lot of work. So our primary focus is advocacy at the country level to encourage governments to implement the 4 top measures to reduce demand for tobacco laid out in the WHO Framework Convention on Tobacco Control. Those are tobacco taxes, bans on advertising, plain packaging, and graphic warning labels with bans on indoor smoking. It's not rocket science. We see it here in the country, and again, Mike Bloomberg, when he was mayor of New York, was obviously a huge pioneer of that, and the Bloomberg Foundation has been a very important partner with us in all of this. Now, in our work here, what we do is we work through, and this is important, with local, regional, and global partners. But the key is around the local. Even if we have global intermediaries, in each case, in the areas we work, which are Africa and Southeast Asia and China, we find local intermediaries and local voices, because that's who's most persuasive. It's fine to have a WHO message, but when you're in these customized local, you need local people and local messages who are armed with the right information and the tools and can directly access the government ministries. And these efforts have led to significant progress. We've had some great successes recently in new tobacco control policy. Senegal, for example, is one, in large part, again, through very targeted advocacy with local partners, and the current president, Macky Sall, has been a real leader of it. Just passed one of the strongest tobacco control bills on the continent. Similarly, in Southeast Asia, we've seen the Philippines passing an innovative sin tax on tobacco and alcohol, which is unique because the revenue goes to fund universal health care. These wins have been collective, and they've only been possible through close and effective coordination with key partners. And again, Bloomberg Philanthropies has been our closest partner on this, and it's been a catalytic force for tobacco control worldwide. But you need that kind of collaboration to counter such a well-funded industry. The tobacco industry really knows how to do its, and even if it's been a little bit on the back foot in this country and elsewhere, it's still very, very powerful lobbying tools and advocacy trying to restrict those things in many of these developing countries. So our role as a donor is to try and work with those advocates to move nimbly and in sync to counter those efforts. So given the magnitude of the problems we face as a foundation, I hope it's clear from those 3 examples, but I could use many more, from family planning to agriculture to nutrition to financial services, and I'm happy to talk about others even in the non-health area. But that it's critical to achieving our goals. The scale of the problems that we seek to tackle as a foundation, that you all seek to tackle here at Johns Hopkins, are global in reach, global impact, global in need, and they require global efforts. They require governments, they require private sector partners, they require engaged civil society. It really is about leverage. In fact, sometimes when people go, well, what is your job, when it says that you're president of global policy and advocacy, and we understand what that advocacy is because of communications. And I go, the easiest way for me to summarize it is advocacy is essentially about leverage. It's about trying to get other partners from whatever sector aligned around a common set of objectives, which we think and we believe, because we're very much at the Gates Foundation, believe in evidence-based advocacy. Everything that we advocate for, we think, has a very strong grounding in interventions that we are confident have a dramatic impact, whether it's driving down child mortality or increasing the access to family planning for women in need. and building those coalitions, then driving them forward, and then building on that success. The example of Gavi, again, which has come from its small beginnings to get bigger and bigger, but each as it gets bigger is actually more effective in terms of its reach, and the results are huge in terms of the most important metric we can think of, which is lives saved. And so in conclusion, just building on those successful examples of how you build these big global partnerships, our hope is that next year in 2015, where the world has an incredible important opportunity to reset its goals, its development agenda for the following 15 years, that we'll be able to not just redo that, setting those important goals in an updated and technically sound and measurable manner, but actually take this kind of experience we've had about building these global coalitions and really accelerate that progress. Because I think in the next 15 years, we have that unique opportunity that's never been available to another generation to actually largely end the inequities between global health outcomes in rich and poor countries. And that's something I hope, in partnership with nearly all of you in the room, and certainly with Johns Hopkins, but many others, that's something we will go on to do together. So thank you very much.
So Mark has agreed for a Q&A. We have 2 mics there. Free tuition for the first person, like Mike.
Don't look at me. Do not look at me. That was Cardin, Senator Cardin. Only he can make it.
Don't be shy.
Hi, is this on? So Lois Prebourdon from IVAC, and I really enjoyed your talk. We do a lot of work with the Gates Foundation advocating for polio and rotavirus vaccines. One of the challenges we find is that when we're advocating, we advocate for one thing, but inadvertently, crowd out other issues, and you had mentioned that in your remarks. I was just wondering what you see as the role of the Gates Foundation in ensuring that the countries are continuing to maintain a focus on things like routine immunization and other priorities that they may have.
Great. Well, specifically again, polio is a particularly good example of that, because one of the very explicit, the reason why that summit in Abu Dhabi was called a Global Vaccine Summit and not a Global Polio Summit was actually to be much more explicit. One of our concerns was, looking back, is that there'd been, because the Global Polio Eradication Initiative is its own initiative, and important and critically so, but there'd been almost this parallel structure and that many of the lessons and successes we had building the polio campaign weren't being appropriately transferred and embedded and being used for the very important routine immunization and other primary healthcare services and systems. So India right now is a very good case study of trying to adapt that very incredible infrastructure that they built around polio and helping enhance the routine immunization, basic primary healthcare, and that's now a very intentional focus of the last push around polio. And it is critical because all these interventions come together around, I just cited the rotavirus because that's one where we entered, but it's the same child getting all those interventions. It's the same mother who has to get her child at interventions, who also is often seeking family planning support for themselves, or needs advice on nutrition and postnatal care and all these things. And so actually at the foundation, it's something that we ourselves realize we haven't been particularly good at internally historically, that because we've been organized by our own sectoral priorities, we've sometimes missed and exacerbated the problem you're talking about, both in talking to donors. Historically, one of the reasons my team exists in a unified way is we'd find that our own advocates would walk into, say, Senator Cardin's office, and it would be our HIV advocacy team coming to talk to them, and the next person would be our agricultural advocacy team, and they hadn't talked to each other. And so now we really are trying to make sure that both when you're dealing with partners like, say, USAID here, or whether you're dealing with a particular government, that first you have that context of understanding this is broadly about the healthcare system, and we in fact have built a new team at the Gates Foundation in the last couple of years that focuses on integrated delivery and really is trying to pull the tools and levers from the different groups against some of these sort of common platforms. It's still not easy to do because the paradox is, from the advocacy, often single issue advocacy is more able to target. The HIV case is a very important and critical one, but what led to the development of the Global Fund to fight HIV, TB, and malaria, and the PEPFAR response here, which has been hugely important and critical, but it has led to these challenges, which lead to debates about, well, does it distort some of the global funding and allocation around health resources in other areas? And we've made a lot of progress, but we're certainly not all the way there yet. There, then there. Okay. Go ahead.
Hi, I'm Ayala Hines with Change University. Thank you so much for your remarks. I'm curious about how the Gates Foundation's work advocating for individuals by the delivery of direct services compares to advocating, say, the U.S. Congress and other governments to apply pressure to increase the international aid budget. So advocating for policy which would affect a lot of people versus the direct services that your foundation supports.
Yeah, so we're absolutely about increasing the overall aid budget. And we actually believe that using examples, the problem is, and we've supported quite a lot of message testing which confirms this, is when you use broad brush terms like aid, the broader public just understand and are often suspicious around it, and you get all these sort of false perceptions that, oh, it's all money that disappears, does it all go on corruption? Where's it go? And so we actually find the most effective way to make the case for broader aid is by using some of these concrete examples like Gavi, or like in other areas, a recent thing that the US government has been leading on in the Feed the Future initiative, which shows you how it's supporting smallholder farmers, particularly women, to improve productivity and incomes and nutrition for their children. And by making that concrete, that actually, Senator Cardin has left, but he's a real leader on these issues, several other, that helps them make the case. Wrapping up, I was at a great event on Capitol Hill a few months ago around child survival. It's after Raj Shah from AID had held a child survival event that I was speaking at that morning, and then it had on Capitol Hill this great coalition. I don't think there are very many events on Capitol Hill these days that have speaking back to back. I think we had Steny Hoyer, there was with then Senator Lindsey Graham, and then Representative Chris Smith from the Republicans. It was as bipartisan you get, and all saying this is fundamentally about American values and needs, is we do want to support a broader effort to support child health, and that's a central element of the aid budget. So you have to mix, and that's a bit, but absolutely that kind of focus on the direct service delivery outcomes, we strongly believe helps reinforce the case for the overall budget envelope, which is what you need. That's the critical foundation of which all these resources come from.
Thanks for your comments and your analysis of the strategy of the foundation and the importance of the MDG. And I think one of the things that led to the impact that the foundation has had is it is very focused. It realizes with the vast resources that Bill and Melinda have brought to the table that it's finite and you can't do a lot of things. So we're going from 8 MDGs to now it's 17 priority areas with several hundred indices. And my concern is that that's going to be very challenging to develop a framework in which donors, countries, NGOs can rally around if we don't, in fact, narrow it down and have a focus, which invariably means that there's going to be some losers. It's unavoidable. And it's not like there's not important things that were left out of the MDGs. For example, non-communicable diseases. There's no doubt that's going to be one of the priority areas in the new post-2015 agenda. So what is your advice on how to deal with this, I think, very serious threat to having a focused approach to development?
No, it's a great question and something that we've been very concerned about, and Bill and Melinda I know are very concerned about, because you're right. The MDGs, the thing is, I'm no longer at the UN. I can say this, but Bill occasionally is prone to say the MDGs are the only really good thing the UN has ever done, and now they're about to mess it up. But what was different about the MDGs, and we have lots of great partnerships with UNICEF and UNDP, and we do believe the UN does lots of other very great things. But the power of the MDGs was kind of as you say, a prioritization and a framing, and done in this succinct, clear way that anybody can, when you have a goal like reduce child mortality by 2/3, it's very clear. Our data is relatively good. It's not perfect, but we can actually measure and track it. Heads of state can be accountable. I'm struck time and again when I'm visiting countries in Africa or Asia, how the ministers themselves will come up and lead with saying, here's where we are in MDG 4, here's where we are in MDG 5. It's helped provide a focusing at national level, it's helped provide a focusing by donors, and that is very much at risk. The current draft that was developed by this open working group, which is a group of UN diplomats, as you say, has 17 clusters of goals and 167 indicators, I think it is, targets. It was referred to, I was in New York for the UN General Assembly, and someone was referring to as the No Target Left Behind document. And when you look at it, everything's worthy in there. There's not a single one of those 160 you say that would be a bad thing. But it's covering jobs and growth and energy and security and violence against women and things. I mean, they're all great. But as you say, 167 priorities is no priorities. And so what we're trying to do is, it's very difficult. You don't want to come and shoot down any of these and say these aren't important. And so what we try and do is just come back and say, look, well, just from our perspective, we have some expertise in key areas, particularly in the health ones. And we'll tell you what we think has worked and why it's worked. This kind of, and we say why this is so essential in the next set of goals. And I think there will be, and several governments, and I talked to the UN, some efforts to narrow down the agenda. I think the odds of it being narrowed down to something as focused as the MDGs is very low, because there are just too many powerful constituencies. But I think there is a real opportunity, and where we're focusing is to make the core set of updated health goals very clear and focused and metrically sound. So we've been working with, say, UNICEF, the World Health Organization, the World Bank, AID, a number of other agencies, in something like child mortality, where the current framing, the goal is simply to end preventable child deaths by 2030. Which is a great phrase, and a very powerful vision. In fact, President Obama has already used it, and you can see why it's politically attractive, but it's not very precise. So what we've kind of worked a little bit behind the scenes with something to say, well, what actually is a plausible target? And we think, in this case, it's 25 per thousand. This is something we've worked with a number of technical experts. It's a plausible number to aim for. And I like to do that viscerally. Sometimes when I speak and tell the story, I sort of go to an audience and say, let's look at the example of Ethiopia, which is a substantial country, 90 million people, nearly 95 million now, and say that currently in Ethiopia, 1 in every 15 children dies before the age of 5, which is compared to the best performing rich countries where that's 1 in 1,000. And so it's a terrible disconnect. And they say, but what if I told you that number in Ethiopia in 1990 was 1 in 5. And actually, they have met the Millennium Development Goal and reduced child mortality by 2/3. And if you track that down to 25 per thousand would be to reduce that to 1 in 40. So if you look around this room and say most of your tables are 5, or it used to be 1 in every person at that table would die. So, and now 1 in 40 is really a number that's getting pretty close to the best middle income countries. Having something like that, just a few things, this is where we're really focusing our attention. So in the areas of child mortality, maternal mortality, nutrition, sanitation, some other key areas, we're trying to work to get those technical constituents and say, can we make sure that embedded in these goals are those clear targets? Because in practice, so many of the other loose goals really, won't generate a lot of that. It's the targets that actually help drive the attention by policymakers. So we don't know. There's still high risks, but that's what we're really trying to help do, and we've got a lot of support from within the UN and some of the other key agencies.